Ivor Cummins completed a chemical degree at University College Dublin in 1990. Since then, he spent over 25 years in corporate technical leadership and management positions. Ivor's focus and speciality is leading teams in complex problem-solving scenarios. Ivor, welcome to the program.
Thanks a lot, George. It's an
Now
honor to
that
be here.
sounds very complicated. We've got a very complicated problem, probably one of the most complicated problems you've faced, and you're not a medic. So what's your take on this?
Right, George. Well, I've been following this and 7 days a week on it since around April. So the complex problem solving covers everything, actually. I have a biochemical engineering degree and I've been lecturing on metabolism and health for many, many years. So complex problem solving as an art involves logic, data, and all of the different specialties to bring together an integrated picture. And this is a big multi-factor problem, exactly what I've spent decades on. So the bottom line is, I think, that this is, and it's now published on the WHO website as of 2 weeks ago, that the infection fatality rate is 0.23% and 0.05% for people below 70. So it is in the envelope of a very severe flu. So it's been very sad. Lots of people have passed, but there needs to be some kind of perspective now that the WHO have published that. So I think there's unfortunately an overreaction that was appropriate in March. We didn't know for sure what was coming. Lockdowns happened, even though they breached the 2019 WHO pandemic guidelines totally, but there was fear. But after a few weeks, when it went through its seasonal, SARS-CoV-2 went through a seasonal curl as expected, many sad passings, then it began to come down. And that's when the lockdown should have been steadily removed. But I think we saw a different thing happening. There appeared to be a love affair with lockdown type mentality, and it carried right through the summer when nothing was happening. So I think that's when I got more and more engaged, wondering, why are they not following the data and the science?
Okay, Ivor, forgive me, but one of the things I know that you've done is you've noticed that it's like flu in a way. So in the northern hemisphere, this thing increases in the winter, whereas in the southern hemisphere, it increases in their winter, which is our summer. So is that important?
Yeah, I think the seasonality is very important. So I put out videos over many months and showed that although SARS-CoV-2 was verified in human sewage in November 2019 in Brazil and in Europe, Europe in March or so had the big spike, the classic Northern European influenza curve, which is kind of independent of many things. And then Brazil, and we see Peru, had the long, steady rise, and they peaked and now they're coming down. So the patterns all match the work of Hope Simpson, who worked for 50 years, a doctor, and produced books on these matters.
But Ivor, like you and I are now in real danger with people watching because we're saying flu. And I can imagine a lot of people saying, hold on here, the boys are really diminishing the danger of this. They're diminishing its effect on people. People are dying, and they're calling it flu. Why have you, and you have deliberately talked about influenza?
Right. Well, because its seasonal nature is very similar, it's pretty much on the order of a very severe flu. Or I love what Dr. John Lee, Professor Lee in England, said on Primetime a couple of weeks ago, within the envelope of a severe flu. And it's worse for elderly people and it's less bad for young. So Professor John Ioannidis, one of the most cited scientists, a doctor and an epidemiological world leader, has published extensively on this and indicates the same thing. I mean, that's just the data, George. We can't escape from the data.
Data is very important to any scientist, okay? But if we can't look at this through the prism of just Ireland, I mean, after all, Britain is in lockdown, Spain's in lockdown, Germany's in lockdown, so they all can't be wrong. It's not just us are locking down. How do you respond to that?
Well, unfortunately, people believe we can't all be mistaken or get into groupthink, even in science, and, get wrapped up in the problem and maybe get things out of perspective. But it does happen, and it's happened many times in the past with Semmelweis, many, many examples. So it can happen. I think that the government's created a lot of fear in the people with round-the-clock advertising. We've seen this for 6 months, and that was to make sure they complied, because there was a concern around this issue, of course. But I think they've created so much fear now that the fear is being mirrored back to them. So I think there's this destructive loop is happening around Europe, and also a Me Too, where countries are looking at other countries and saying, well, they can't be wrong. So the third factor in it is there are worldwide bodies like the WHO and many more who have been strongly advocating lockdown all the time to all the governments through the government's leadership panels. So that's a factor that can't be ignored. Now, you could say maybe they're all correct. However, we have the Lancet published in June, and we have the paper and around 15 more papers, and they show clearly that lockdown has very little impact on the mortality per million per country. And that's kind of a scientific fact that's not being discussed, even though it's published on. And the other thing is that there are even papers published, one in BMJ and another preprint, that advanced analysis has been done. And although it's counterintuitive, it's showing that lockdowns may suppress and protect your hospital somewhat, if indeed you need that, if you're over capacity. But the long-term effect may be more COVID-19 deaths. And that's complex, but it makes a lot of sense if you're a scientific person.
Okay, I'm glad you used the word complex, right? Because in our opening, I talked about 25 years of complex problem solving by you, Ivor Cummins. So you've got a complex problem here, which is COVID-19 pandemic. Solve it, please.
Okay, so yeah, I'm drawn to it like a duck to water. So really quickly, my two motivations primarily are, first, I have 5 children and I'm concerned with public health. I've been lecturing on preventative measures for 8 years. So my concern with overall public health is driving me like a demon, because I think here we've made it all COVID and it's catastrophic approach. And the other thing that drives me is truth in science and solving the problems. So we'll get into that. There's around 45,000 doctors, professors and scientists have signed the Great Barrington Declaration. Now, the media have attacked it, but the reality is 45,000 doctors and scientists. And I would largely agree with them. And
the Barrington Declaration, remind me.
gbdeclaration.org. So it's Great Barrington, it's Professor Gupta from Oxford and professors from Stanford and Harvard, the top of medicine and epidemiology, put together this proposal going forward. And it actually agrees with the 2 published papers I told you, one of which was in the BMJ, that lockdown, the best approach is to shield the vulnerable in so much as you can, and then not let it rip, not at all, but allow reasonable normalcy in the less at risk. And that will protect the elderly in the long run. It will actually help to save Granny based on the analyses. But I don't think that's popular because the narrative is so powerful now. There's too many reputations at risk, I feel.
What about the Irish situation? The fact that when Britain announced something, we see the PM or a cabinet minister flanked by the scientific experts. The contrary happens here, really. We see the scientific experts telling us what to do, and then somewhere along the line, a government person comes along. What concerns have you that science is leading us by the nose, if that's not true? Crude?
Well, I'd say science in quotes is leading us by the nose, which is a bigger problem. So I think the politicians are essentially lost. And the reality is, in the political world, you will defer to the science people because if you get it wrong, you're in trouble. If you follow them, you can blame them for all the collateral death and suffering. So the politicians are going to roll, and they're rolling with NPHET. Now, NPHET are basing pretty much everything on modelling, which has been essentially debunked. So the original Neil Ferguson Imperial College modelling was out by a factor of 10 to 12 in impact. And this is essentially de facto proven now. But they're using the same, and there's an Imperial person, I think, on the team, the modelling team in Ireland, which is not good news. And they are pumping out modelling predictions which are not borne out in reality across the world generally.
All right, I need, and it's very hard for a scientist to give me an answer in under 60 seconds. In 60 seconds, tell me what we should be doing.
Okay, we should be looking like a hawk at the ICU loading relative to prior years as our signal for taking extreme measures that are appropriate for extreme situations. We should be looking at the mortality rates. And you can look at hospitalization rates, but be careful, because a broken ankle who gets a positive COVID or SARS-CoV-2 PCR test is going to go down as a hospitalization. So I'd say they're the real measures. And if they're becoming really problematic with much higher loading than prior seasons, then you can begin to consider severe draconian measures. But I would say that people must understand that in the UK over the past 2 months, we see that the excess death that's occurring is all in the home and in younger people. In other words, we would say it's lockdown-induced deaths. So we are throwing out our economy, our people, our population health, all discarded effectively on the basis of one endemic virus that's already had its epidemic last March and now is a winter resurgence, which is very likely quite manageable.
Ivor Cummins, thank you for joining me here on COVID recovery.